Okay, good afternoon, guys. We will continue from where we left off. So we left off with the different types of keratoplasties. Okay, so the indications and the various techniques of keratoplasties. So that is where we stopped. So this video, we will be talking about how you're going to harvest the donor cornea and how do you store them. Okay, because that's a part of keratoplasty. Are there people around? If people are around, I think we should start. Okay, so how do you harvest? So that's again another, from your point of view, that's another MCQ. So what is the most common indication for which enucleation is done? Okay, so enucleation is you're going to remove the eyeball. Yes, so you're going to just pluck off the eyeball. So that is called enucleation. So the most common indication for of doing enucleation is for harvesting a donor cornea. Okay, so after death, when you remove the eyeball for getting a corneal donor, that is the most common indication. All right, and so what do you do? Okay, wait, let me just see if I've got that. Okay, I couldn't find my smiley ball. All right, okay. So let's say this is the eyeball with all the muscles attached. Okay, so let's say there's an optic nerve behind. Okay, so there's an optic nerve behind, and there are muscles all around. So you detach the muscles and you can remove the eyeball. Okay, so basically you do a peritomy. So let's say this is the nimbus. Peritomy is cutting the conjunctiva. So once you cut open the conjunctiva, you can go behind, hook the muscles, and once you hook the muscles, you can cut off the muscles and cut the optic nerve, and you can take off the eyeball. So this eyeball is stored, okay, as a whole eyeball. When you bring it back, you normally store it in normal saline or balanced salt solution. Okay, and so you got to store it till the cornea is being used. So there are different methods of storage, or what we call as storage media. Now, why are we worried about the storage media? Because your cornea has to be healthy. Okay, so when you transplant, the cornea has to be healthy, or in other words, the endothelium has to be healthy, because the endothelium is of course the most vital layer of the cornea. All right, now why are we concerned about this endothelium? Because once the patient is, or the person is dead, the aqueous formation stops and the aqueous circulation stops. So once the aqueous circulation stops, the cornea, which derives its nutrition from the aqueous, is definitely going to accumulate toxic end products, and its metabolism is going to come to a standstill, and the endothelial pumps are not going to function. Okay, so the sodium potassium ATPase pumps and the bicarbonate pumps, which help to keep the cornea in a dehydrated state, okay, a relatively dehydrated state. So they're not going to function as well, okay, or maybe the function is just going to stop, and the endothelium is going to become dysfunctional. So we have to make sure that we keep this eye, or this corneoscleral rim. Okay, so you take the eyeball and later you dissect out only the cornea. Okay, cornea with a little bit of the sclera around. Okay, so only that bit is there. So you preserve it in a medium which is going to sustain this endothelial activity, metabolic activity, or it's going to bring it to a standstill, so that there's no metabolism at all, in the sense there's no catabolism as well. See, only when you have catabolism, you'll have toxic metabolites. So nothing happens, and the media should have a composition which is somewhat mimicking aqueous humor. Okay, so that's the whole point. Now, so when you talk about storage medium, we have short term, intermediate, long term, and very long term storage medium based on how long. Okay, so so there are two basic functions, or basic indications for the storage medium. One is it has to preserve the endothelial integrity, okay, the corneal endothelial integrity, that is the innermost layer of the cornea. And number two, it has to increase the duration of storage. Okay, because maybe today I harvest a cornea, and maybe you don't have patients, so by the time the patient comes, so we have to hold it for some amount of time, retaining the endothelial viability. Okay, so these are the two main aims of choosing an appropriate storage medium. All right, so when we talk about short term is you can just store it in a moist chamber. Now, moist chamber means, don't think there's a big chamber and all. Okay, it's just a small bottle which has normal saline, and you immerse this eyeball or just the corneoscleral rim into it. and it has to be used within 24 hours. So the best results are got within 24 hours, and more than 24 hours usually we do not use it. Okay, so this is short term moist chamber, which is nothing but normal saline, and you keep it in the refrigerator. Okay, you keep it at 4 degrees Celsius. You don't freeze it, you keep it at the sides of the refrigerator. So this is one of the short term. And number 2 is your MK medium, McCarrick-Kaufman medium. Now, what is the advantage of this McCarrick-Kaufman medium is it has some nutrients. Okay, it's not just normal saline, it has nutrients, it has antibiotics, and it's got this 5% dextran. Now, what is dextran? Dextran is osmotically active substance. So when you say it's osmotically active substance, it's going to imbibe water. Or in other words, if it retains water, water will not accumulate in your cornea. Cornea swelling will not happen. All right. So that's the whole point. And when you use this MK medium, the cornea can be preserved for up to 3 days. 3 days is a good time. Okay. So these two are short term. Now, with the addition of chondroitin sulfate, okay, with the addition of chondroitin sulfate, can increase the duration of storage. So we've got intermediate storage. So what are the different media which come under intermediate storage? It started with something called K-sol, okay, K and SOL, K-sol, all right. And then they came up with something called Optisol. Okay, so Optisol had come in. So Optisol is quite preferred, and with K-sol, the duration of storage was up to say 10 days. And Optisol was up to 2 weeks. Okay, they claim more than that, but effectively for 2 weeks it can be used. Okay, so Optisol. So Optisol contains chondroitin sulfate, and it has dextran definitely, but a very a quite lower concentration of dextran, 1% dextran. Okay, so this is Optisol. So these come under intermediate. Okay, intermediate, and even under intermediate, these when you use MK medium or K-sol or Optisol or these are called hypothermic methods of storage medium. Hypothermic, why? Because you'll have to definitely keep it at 4 degrees Celsius. Okay, to keep it at 4 degrees Celsius. So you keep it in the refrigerator on the sides, not in the freezer. All right. So these are hypothermic methods. Now coming to long term. Long term, also called as normothermic. Okay, so that's organ culture. Now what is this organ culture? Now if you've done tissue culture, you will know that we use some media. Okay, so Dalbeco's media, Eagle's medium, all that. So and it has this fetal calf serum, FCS is there. So that will help in keeping the cells metabolically active, right? So organ culture is under long term. Okay, long term means a month. Okay, it can be used for a month, so 4 weeks. So that the ideal thing is 4 weeks. Okay, so that's organ culture. So in organ culture, what is done is, so this cornea is preserved in the medium. Okay, so Dalbeco medium or Eagle's medium, modified Eagle's medium. So it's placed there. But when you want to use it for surgery, when you want to use that cornea for surgery, then you have to put it again in dextran. Okay, so that is what is called as, when you use organ culture, there are 2 phases. What are the 2 phases? One is a storage phase, where it is actually there in the storage medium, and number 2 is what we call as transport phase. Transport phase is, okay, so today I've decided, okay, I inform the eye bank, okay, we posted a surgery after a few days. Okay, so it needs to three days or something, it needs to be placed in dextran to take out the water. Okay, take out the water and thin out the cornea. Okay, so when you use organ culture, there are 2 phases. Okay, so one is the storage phase and is a transport phase. So transport phase is to thin out the cornea, and then you use it for surgery. Okay, now in organ culture, there's all and this is normothermic. Why? Because we are not keeping it at 4 degrees Celsius. We maintain this entire thing at 31 to 37 degrees Celsius. Okay, it's somewhere around room temperature. So that's why it's called normothermic method of preservation. All right, now the problem with this is, because you have active ingredients like this, you have fetal calf serum, and all these nutrients there, so there is a chance of the media getting contaminated. Now if it gets contaminated, you just throw away the cornea. Okay, just throw away the cornea, no questions asked, right? So you should have very, very good lab practices if we are adopting organ culture. Okay, now there's a very long storage medium. Now what is that? So you basically cryopreserve. Okay, cryopreservation in DMSO. Okay, DMSO is, I think, I'm not going into what is DMSO, I just forgot. So in DMSO you store that, but that's pretty expensive and not everybody does that. Theoretically it can be used even after years. So that is about the long-term storage media. Okay, so this is about keratoplasty part 2. So this part 2 video is about how do you harvest it. So basically you do enucleation, take the eyeball and later dissect out the corneoscleral rim and preserve it. Okay, and if you're doing it within 24 hours in moist chamber, you can put the entire eyeball into the normal saline, just making sure that the entire thing is not drowning in the fluid. Okay, so the cornea is exposed, it's moist but it's not drowned in the fluid. That's the only precaution that you have to take with moist chamber. So this video is covering that and the storage medium. Okay, if you have any doubts, please let me know in the comments. Okay, so thank you guys. Good.